Actress Olivia Munn recently revealed that she was diagnosed with breast cancer and underwent a double mastectomy, thanking her doctors and urging women to calculate their own risk assessment. Joining us now to talk about what women need to know is breast surgeon Dr. Sayee Kiran. Thanks so much for being with us this
Thanks
afternoon.
for having me.
We appreciate it. First and foremost, Munn credited this breast cancer risk assessment. I think so many people jumped on Google to explain what that is. She credited it for saving her life. Can you explain what that is? What is the score?
Absolutely. So there are a number of models that we use to calculate said score. And basically what it is a woman's lifetime exposure to estrogen. So we take into account how old somebody was when they started their periods, when did they stop having their periods, how many pregnancies, what was the age that you became pregnant, as well as family history of breast cancer, first-degree relatives or second-degree relatives, and any previous biopsies or abnormal test results. All of these things are kind of tabulated together to give us a score. A woman's lifetime, or an average woman's lifetime risk of developing breast cancer is about 13%. Somebody with a high risk is someone that's 20% or higher, and that's how we figure out this score. And then based on that score, we decide what types of screening tools does this woman need. And that could be just a mammogram every year. That could be a mammogram with an ultrasound or even an MRI. And beyond that, we can get even more into helping decrease their risk by taking additional medications and maybe even sometimes doing surgery.
I want to ask you about Olivia Munn's transparency and her vulnerability. Can you see the effects of that? I mean, do you have more calls coming at women who maybe put it at the top of their priority list instead of lower where they keep burying it?
Absolutely. I think especially the time in which we start our screening. So everyone sort of knows that 40 is the magic number, but for this risk assessment tool, we recommend that you talk to your physician about it as early as 25. The reason is that I think there is a common misconception that if you don't have a strong family history for breast cancer that you won't develop it. But the truth is 95% of breast cancers are sporadic. That means it's not related to genes. Only 5% of breast cancers are related to genetic mutation. And that's why it's very, very important to start this discussion and this risk evaluation early. Now, we have seen something similar to Olivia Munn's situation in the past, and that's with Angelina Jolie. And we found that there was a big interest and a big call to us to do these double mastectomies. Now, double mastectomy is not right for everybody, and but the key is to get in early and start the risk assessment.
No, I appreciate you sharing that. Yeah, I'd forgotten she was kind of the first to be just so vulnerable. I wrote a little note here. So Munn said she took a genetic test just last year that checks for 90 cancer genes, and she was negative for all of them. You know, I think some of us believe we're doing our due diligence when we do self-exams or we go get a mammogram, whatever it may be. She clearly has been on top of this, and she kind of was given false comfort before a terrible diagnosis. How does that happen?
Well, there you go. I just said it. 95% of the times it has nothing to do with genes. And it really has more to do with, like I said, the exposure to estrogen, the family history. This is why for every patient that is diagnosed with breast cancer, we offer genetic testing because we know that there's still more information out there that we don't know yet. There must be other genes out there that we still don't know. And by gathering this information from all the breast cancer patients, hopefully down the line, our genetic tests will be a little bit more predictive in terms of someone's lifetime risk.
Dr. Sayee Kiran, thank you so much. We appreciate it, and we hope women, feel inspired to be on top of their health.
I hope so too.
Thank you.